it work?
I think we're live.
We did it. We
Yeah,
did it.
I think we're live. So,
Maybe.
we are live, and my name's Joshua Gerstenlauer, and I'm the most excellent high priest at Samuel C. Perkins, Royal Arch number 209. And with me this evening are several guests, mainly our presenter, King J. Whitall. And tonight we'll be discussing some topics related to health and wellness and his experiences as an EMS. Um, and if anybody needs to reach us, our email is on the slide there, scperkins209@gmail.com. And as we go through this evening, let me see if I can get the slide to change. If I bring up here we go. Okay, so um, this evening we will be talking about EMS and the public health and some of the common things and conditions that can happen. And tonight's no cost, obviously. It's open to anybody and available any day you want. We'll be having another program next month on October 12th. I know it says next week. That's a typo, so it's supposed to say next month. Um, it'll be on the history of Samuel Perkins himself, and that'll be presented by James Bromer. Now, without further ado, I give you James Whitall. How you doing, James?
I'm well. I'm well. How are you, sir?
Not so bad. Jay is our king and also has some other experiences.
Yes. So my name is James Whitall. I'm a paramedic and also past high priest of Sam Perkins Royal Arch chapter. Um, and I've got a short presentation, just going over uh, EMS in the new century, some of the cool equipment that we have, and addressing a couple public health issues. Um, so we can go ahead and get started.
Okay.
There we go. I think I have a little lag. So EMS in 2020 in Pennsylvania here we have several different levels of certification, and each has a scope of practice. Obviously, growing in um, more complex procedures and things like that uh, as you go up from EMT to physician. Um, each has different Con Ed and recertification requirements, especially if you try to maintain the national certification versus just the state. Some of the services offered by EMS in Pennsylvania, obviously emergency response. Some of the specialized services offered is tactical paramedicine. That's where you have a paramedic attached to a SWAT team or police tactical team. Urban search and rescue, like PA Task Force One. Those guys have some pretty cool toys and have a pretty nice scope when there's a national emergency or a natural disaster, rather. Community paramedicine is a big thing, uh, starting to become a big thing, actually. So we see a lot of repeat customers in EMS, which is not necessarily a good thing in this line of work. So, a couple health organizations decided to hire on paramedics that they send out into the community after a patient is discharged from the hospital with the goal of reducing readmissions. And that paramedic kind of serves as like a liaison between you um, and the doc, kind of like a house call. And they make sure you understand your discharge instructions that you're following, your wound cares, getting done, and things like that. We also do a lot of public education, wellness and injury prevention programs. We're out in the schools during Fire Prevention Week, um, doing a whole lot of things there. CPR and first aid classes. We do low cost classes for the community as well. Josh, you can go ahead and switch to the next slide. So these are some of the cool toys that we get to play with. If you saw my presentation in council, I got to bring a couple toys. We brought the Lucas CPR device, which you see in the upper left-hand corner. That is like a piston that you pull down onto someone's chest, and it just kind of does compressions for you, which frees up your hands to do a lot of other things. So, generally when you have two people in an ambulance, um, there's a lot of things to do on one of these calls. So, having a machine take over, doing perfect compressions every time at the perfect rate, it never gets tired. It's great. I love it. Um, Unfortunately, the price tag attached to them doesn't make them easy to come by. Um, on the upper right hand side, you have the LifePak heart monitor, which allows us to monitor several different vital signs, blood pressure, gives us, we can do EKGs, end tidal, carbon dioxide, um, all sorts of fun things. And we can zap you with it if need be. Bottom right hand corner is a small ventilator. Um, if you go into a hospital, you see those massive ones, but obviously in the back of the ambulance, you don't have a lot of room. So you see a lot of more compact equipment coming out. Bottom left is the power load litter or stretcher. These things are amazing. Back savers, shoulder savers. I mean, we've seen way less injuries. We're not having to pick up a patient and the stretcher while someone picks up the wheels and we put them in the ambulance. So these things lift themselves and they load themselves. It's awesome. In the bottom middle there, you've got the IO drill. So in certain emergencies, when we can't get IV access, we just use that little drill and we actually drill down into the bone, into the cavity where marrow is produced, and we can give fluids that way. We can give a lot of medications that way. And there's just a couple different types of IOs
That does
these
not look
days.
like it would feel good.
If you're interested, you can YouTube a video. I think there's, in the military, they do all sorts of things and use themselves as guinea pigs. So there was a video, they did one on a guy that was awake, and it doesn't hurt from what I'm told when you drill in, but when you flush out the cavity with, cold saline, it's a pretty interesting feeling. But there are YouTube videos out there for those that are interested. And in the upper middle, not really a toy, but we've been required to wear body armor the last few years, mostly because of increased attacks on public safety. I just wanted to include that just because it's the nature of the job has definitely changed. Our uniforms are getting away from police-looking uniforms to reduce attacks. It's sad, but fortunately, a lot of the companies are stepping up and purchasing these things for us. All right, next slide. I wanted to go over just a few very common disease processes and things that you can do at home to treat them, um, just to get the information out there. So, cardiac disease is the number one cause of death in the U.S., and this includes things like AFib, which is a cardiac dysrhythmia, um, coronary artery disease, heart failure, things like that. Risk factors are something that we can control, might not be able to eliminate, obviously, like family history and hypertension or cholesterol due to some, genetic issues, but um, we can control high blood pressure by making sure, diet and exercise are, um, our focus, as well as taking any medications that are prescribed by your physician. Um, Signs and symptoms of a heart attack I've listed here: pain in the chest, sometimes in the left arm, the jaw, and the back. I will note that females generally have an atypical presentation, meaning they're special and they don't always have the classic signs and symptoms. So sometimes females can present with, just back pain or maybe even jaw pain, something weird like that. Um,
I
but
get
they're
that all
usually
the
accompanied.
time.
You're not a female. You don't have to worry about that.
Oh, right.
Uh, Usually accompanied by shortness of breath, diaphoresis, which just means you're really sweaty. Um, Emergency treatment that you can do at home, adult aspirin. So one 325 milligram aspirin. Actually, doesn't matter if you've already taken one previously in the day. And this just helps the platelets to not stick together and make that clot worse.
Now, does that work
Um,
for everybody? Like if I felt like I was experiencing a cardiac
yep.
experience like that, can I just take aspirin and that's, you know,
I mean, I would take one adult dose aspirin. Um, and so, what that does, if there actually is a clot in the vasculature of the heart, it just keeps it from getting worse. It doesn't break it up, or it just kind of makes the platelets slippery.
see, these are the conversations I wanted to have because a lot of these symptoms, it's like stuff that people, especially older people, have all the time, or people that
Right.
have injuries or disabilities.
Definitely. And I will note that this can sometimes be confused with general anxiety, which is also very common. Um, so I only mention this because my grandmother called me the other day. She had gone to the hospital thinking she was having the big one, and it actually just turned out to be anxiety. Thankfully, then.
Yeah, it's
Um,
amazing what anxiety and depression, how powerful that can be too.
yeah, absolutely. Um, Continuing on with the treatment, if you have nitroglycerin prescribed to you, this is the time to use it. Um,
Right
give me one
now,
second here. No, not right now. When when you're having the chest pain.
okay.
Generally, if that's been prescribed to you, um, you have a history of this kind of thing, so you should know when the time is to take it. The one thing I will say about nitroglycerin is to make sure that it's uh, not expired, because a lot of people get these prescriptions, and they store them in a cabinet and forget about them, and the time comes to use them, and it doesn't work, uh, and they're taking 3 and 4, and it's because it's expired. Um,
Okay.
EMS. Sorry, I'm trying to plug my phone in here so it doesn't die. Give me one second. All
Bear
right.
with us.
Uh, EMS treatment. I'm sorry, emergency treatment. 911 activation. Obviously, the sooner you call, the sooner we can get there. Especially if you live in a rural area. And some of the things that we can do on the way to the hospital is, first of all, to make sure you're getting to the correct facility, which is a hospital that would have a cardiac cath lab. We can do cardiac monitoring with that cool life pack monitor that I just showed you. We have all sorts of medications like antiarrhythmics and pain medications. We'll get IV access, draw some blood, give you some fluids, and then we also have the ability to electrocute you therapeutically, of course. Um, so, all the more reason to not just throw yourself in the car and drive. We definitely can get you some treatment on the way. Next slide, please. There we go. Uh, Accidents and unintentional injuries. This is, believe it or not, like 85 to 90% of the calls that I run. Um, Falls, usually resulting from a slip or a trip, or somebody got up out of bed too quickly. It's the third leading cause of death in the United States. Um, Especially as we get older, uh, our bones become a little bit more brittle. We don't have the body mass that we used to protect those bones. Our balance gets thrown off for whatever reason, and we just kind of break a little bit more easily. This can be somewhat mitigated. Um, not just talking about falls here, but accidental injuries. They can be mitigated with the use of personal protective equipment and safe work practices. Read your owner's manuals and follow uh, the manufacturer's procedures. That's a big one. Know how your equipment works before you start using it, and trying to take off any fingers. Eye protection, keeping foreign bodies out of your eye, that can be extremely painful and damage your vision for the rest of your life. So wear them, get some anti-fog wipes to keep them from fogging up if that's what you need to do. Um, slips, trips, and falls are deadly and preventable. Um, Again, as you get older, you might be on a blood thinning medication for maybe a stroke or some other condition that you have, and even the a fall that you might not feel injured is enough to damage your vasculature, which can cause bleeding. So anytime you're on those medications and you fall and hit your head, it's a good idea to go get looked at, just because um, there could be a bleed that you're not aware of. Just your head got jarred a little too hard. Um, so better safe than sorry, especially on those meds. Um, Make sure you look where you're going and you can see where you're going. Adequate lighting is important. Night lights, if you're getting up and going to the bathroom in the middle of the night. Remove trip hazards like rugs. Um, and then fall alert systems, if you're in that age category, those are lifesavers. The little necklace, the "Hope I've fallen and I can't get up." I mean, if you're the only one in the house, you're gonna have to make your way to your phone or something else if you don't have one of those buttons. But I really like those, and I encourage people in that would fall into that category to get one.
My grandmother had one.
They're great. I mean, people hit them accidentally all the time. I mean, those calls are fine, like super easy to document. But,
I also thought proper lighting. That's a theater term.
oh my gosh, proper lighting, so important. Oh, and one more note on that: if you have issues with balance, taking your time getting out of bed, uh, super important. That way, you're not getting up and just falling right back down. And I think this is the last condition I wanted to cover, which is stroke, and that is the fifth leading cause of death in the U.S. Um, and we use um, the abbreviation FAST, just to cover the signs and symptoms of the stroke. So if you start experiencing these, face like starts drooping on one side, uh, A's for arms, weakness on one side, your inability to lift the arm or inability to recognize your arm, uh, incoherent speech or slurred speech, means it's time to call for an ambulance. Don't wait because time is brain. Um, Risk factors really similar to cardiac disease. It's crazy, right? Uh, High blood pressure, high cholesterol, smoking, medications like blood thinners, and also vascular disease. So if you already have issues with clots or have had previous strokes, you are at higher risk for
At this
future
point,
stroke.
I feel like you're telling us to expect these things.
I mean, if you've got these risk factors, you're definitely more likely to experience these. So that's why it's important that we control what we can, and just start to eliminate them if we can.
Right.
Um, there's really not a lot that we can do for stroke pre-hospitally aside from what we call giving a diesel bolus, where we drive really fast, which we have lights and sirens, so we can do that. But also making sure that we get you to the appropriate facility, which would be a certified stroke center, so that they can get you the proper care and you have a better chance at recovery. But for stroke and for heart attack, early recognition and intervention is key. So, calling 911 early and making sure you recognize those signs and symptoms.
I mean, what do you have like 4 minute, 4 to 6 minutes or something like that
For
before you're damaging the brain?
Without oxygen, yeah. So a lot of people, stroke care's come a long way actually. They can go in. So usually we give what's called TPA. I say we, I mean the hospitals. They don't let us have those things. TPA is a clot busting drug. So if they think you have an occlusive stroke, like there's a clot in your brain somewhere causing blood flow interruption, they want to break that up as quick as possible. So basically, they pump you full of this blood thinner, and it just kind of dissolves the clot. Um, there are risks associated with that, obviously, but um, I think Hershey Med is actually doing clot retrieval now. So there used to be, it was like 6 hours. You start looking at permanent brain deficits, um,
Okay.
if you don't get treatment right away. Um, but now, like, I mean, up to I think 12 hours later. Don't quote me on that, but like over 6 hours, they can go in and actually retrieve the clot and reperfuse that part of the brain. You still might
Potentially.
have neurological deficits. So, like, the longer you wait with a stroke, the higher chance that the symptoms you're experiencing become permanent. So that's why that's key. The early intervention. And I have to apologize. I feel like I'm rambling a little bit. It's because I'm exhausted.
Oh, that's totally fine. We made it.
Oh, we did make it. Also, I know nobody can really ask questions because we're live at like 9 o'clock and nobody's watching this. Um, because we had some tech issues. But anyway, I do offer first aid and CPR classes, low cost, especially if you're a brother or a companion. Just get with me, and it's maybe like $2 to cover the cost of the card.
Hey, I'm pretty sure
And
mine's expired. I need to re-up.
I mean, if
Maybe not
only
first
you
aid, but
knew,
definitely CPR.
if only you knew a CPR instructor.
If only, if only.
Um, and then if you're worried about fall hazards, I can come do like a home hazard consultation and just kind of point out some things that might be an issue to you. And obviously, no cost for that. Just shoot me an email or reach out to Josh, and we can make that happen.
All right. So before we take off, I just kind of wanted to wrap up. I'm a teacher, so we like to wrap up, right? So what? I always do a so what? So what's the point of all that? So I asked our king here tonight to a couple times to present on these topics because I think it pays to know your body and health. It pays to know your own body as opposed to just kind of going with the flow or whatever, getting to know yourself so that you can tell the difference between what's anxiety or what's your normal pain stuff or as opposed to these sort of symptoms and signs of more chronic issues or more severe or fatal issues. So I along the lines with everything he said tonight, it's important to prevent these common health issues. And I included in parentheses when possible, simply because it's not always possible. I mean, there's some genetic things that can't be manipulated environmentally. Ooh, that sounded smart. So it is important to seek help during, heart attacks or cardiac events, strokes, falls, and other major injuries. So I think when we experience these signs, symptoms, or events, seeking EMS immediately is probably the best decision. So I mean, we're grateful for um, Jay and what he does and has been doing for a number of years. Right now, are you still at Elizabethtown?
Uh, yeah, I'm per diem there.
Okay, so he's currently doing some EMS work at Elizabethtown Masonic Homes. So uh, you might see him if any of the brethren that live there are watching or frequent there. So Jay, I just wanted to take the time to thank you again for taking time out of your evening because I know you have a little boy at home who needs tucked in, right? So
Yes, he fell asleep during my presentation
I
actually. So
told you he would. So
yep, it was way past bedtime, but anytime I'm happy to present.
all right, well that's all we have for this evening's program. Thank you, King Jay, and thank you everyone who gets a chance to view our video and check us out on October 12th. Best
Yay.
wishes and respect, my brother.
Yeah. You as well. Bye, y'all.